How much do you know about the black dog of depression?
Depression is a mental disorder, showing itself by following symptoms. 1. Continuous low mood throughout day and night. 2. Having no good feelings about routine and joyful activities, including specific activities which were joyful in the past. 3. Sleeping problems, which means too much sleep or less than usual. 4. Having difficulties in concentration and learning abilities. 5. Eating too much or less than usual. 6. Being forgetful frequently. 7. Feeling guilty and lack of self-confidence. 8. Thinking of suicide or harming other people. 9. Visual or auditory hallucinations, which means seeing or hearing something or somebody that doesn't exist. 10. Physical pain in body organs called fibromyalgia. 11. Losing temper, very easily called irritability. 12. Lack of energy and motivation for even routine works of the day, like not caring about personal hygiene. 13. Dysfunctionality of the logical analysis of personal or family problems. The mentioned symptoms could be created by other mental disorders too, so it is important to diagnose depression properly, because the treatment methods of each disorder could be totally different. The psychiatrist or the psychologist are the people who can diagnose the mental problem of each person correctly. Remember, mental disorders must be under supervision of the therapist, at least for a short period of time, because the patient could harm himself or others directly or even indirectly by his abnormal thoughts and actions. Depression could be a part of another mental disorder, like bipolar or PTSD. In some cases, depression is the secondary outcome of a main disease like dementia or Parkinson's syndrome. But depression alone as a main disorder divides into different types like 1. Seasonal affective disorder, or SAD, which means in some parts of the year, like winter months or fall time, it usually takes place for some people who are in normal mental state on the other times of the year. 2. Postpartum depression, or PPD. Around 10% of women during pregnancy or after giving birth will experience it. Bad temper, mood swings, feeling guilty, failure or disappointment, too much sensitivity and crying suddenly without any reason are some of the symptoms of it. 3. Catatonic depression. It's a rare but severe kind of depression which involves movement disturbances in addition to typical depression symptoms. This type is much like schizophrenia.
4. Depression with anxious distress. It refers to a condition when depression synchronizes with anxiety disorders. This one could really make the person mentally unstable and needs the therapist's attention. The patient will show depression and mania symptoms periodically, like bipolar.